Hi, my name is Randy Esquivel. My partners are Santiago Carrasco, Sofia Lopez, Joseph Ramirez Tellez, and Anthony Vasquez. So today we're going to be presenting the impact of a diet in Hashimoto's thyroid disease, nutrition control, anti-inflammatory diet, and a Mediterranean diet as a protective method. Okay, so table of contents. So we're going to be presenting our introduction, case study, PICO statement, search methods, synthesis of evidence, nursing implications, conclusion, and references. Okay, so for the introduction. Okay, so what is Hashimoto's thyroiditis? So Hashimoto thyroiditis is an autoimmune disorder in which the autoimmune system in the body accidentally attacks the thyroid gland. This generally leads to hypothyroidism, which causes symptoms such as fatigue, constipation, weight gain, sensitivity to cold, and can also lead to depression. So there is proper diet and nutrition. So an implementation of an anti-inflammatory diet will benefit the patient generally and will consist of increasing fruits, vegetables, healthy fats, iron, vitamin D, omega-3 foods, and lean proteins. So although this type of diet is hard to follow for some people, individuals with Hashimoto's thyroiditis will follow it since it is shown that this diet helps treat unwanted symptoms. This diet is supported by various articles due to the benefit it has against this disease. Ongoing research about these types of diets show how it can benefit individuals with this disease by reducing inflammation and managing thyroid function to increase their quality of life.
So my name is Sofia Lopez. I'm going to be doing the case study. So we conducted an interview with a Hispanic 21-year-old male diagnosed with Hashimoto's at 10 years old. The patient had no surgeries, has an allergy to ibuprofen, and is up to date on his immunizations. Both overactive and underactive thyroid issues have been diagnosed within his mother, maternal grandfather, and both paternal grandparents. He has a history of leukopenia and frequent infections, both side effects of Hashimoto's disease. He reports symptoms of tiredness, irritability, dry skin, and difficulty gaining weight. He takes his levothyroxine medication daily as prescribed to regulate his thyroid hormones. The patient reports occasional tiredness and mood changes that affect his ability to concentrate at school and sometimes make it harder for him to push through his very active lifestyle. His last visit to the doctor revealed low white blood cell counts, high thyroid peroxidase antibodies, and slightly less than normal thyroid hormones. After being advised to start a gluten-free diet by his primary care provider and nutritionist, he did not follow the recommendation due to its inconvenience and not wanting to stop consuming his favorite meals. He relies on his levothyroxine medication to control his autoimmune disease, as he reports no side effects from the medication. However, he reports wondering about how a gluten-free diet will improve his symptoms. After concluding the interview, it was determined that the patient has lack of knowledge surrounding the possible effects of a gluten-free diet on Hashimoto's thyroiditis compared to his normal diet. This calls into question, in adults with Hashimoto's disease, what is the effect of an anti-inflammatory diet with the prescribed medication compared to a normal diet with compliance to the prescribed medication? Improve the patient's quality of life.
My name's Anthony. I'm going to be presenting the PICO statement. So for our key concepts, we have population and patients. With this, we put adults with Hashimoto's disease that are compliant with medication. For intervention, we have anti-inflammatory diet. And for comparative, we have a regular diet. For the outcome, we want to see an improvement in the patient's quality of life. And for the time frame, we have over the lifetime of the patient with the anti-inflammatory diet. So this made us form our PICO question, which was, in adults with Hashimoto's disease who are complying with medication, is the effect of an anti-inflammatory diet compared to a regular diet improve the patient's quality of life?
My name is Santiago Carrasco, and I'll be talking about our search method. So our research process was that we interviewed a patient about his health concerns, including a thorough health history. We also used the patient's greatest health concerns to make our PGOT question. While doing research, we used keywords like Hashimoto thyroiditis and anti-inflammatory diet on YouTube databases, which is included CINO and Medline, to find relevant research within the last 5 years. We also found and analyzed research that had strong association to our question, and we gathered relevant data to integrate into our report. Now for our operators and limiters, we have a population, which is adults with Hashimoto's thyroiditis on normal diet and taking thyroid medication. Our interventions, which is anti-inflammatory diets. Comparison between anti-inflammatory diet while taking prescribed medications, and the outcomes which improve the quality of life and the unwanted symptoms.
My name is Joseph Ramirez, and I'll be presenting the synthesis of evidence. So for our qualitative study, the aim and purpose was to explore the patient's opinions on the role of the diet, the problems they encounter, and the need for better dietary advice. The sample was 30 participants who were mainly women with an average age of 45 years formed the sample of the study. Data collected methods. In-depth interviews were employed to collect data so that participants could express themselves in their own way. And major findings. There's a need to include nutritional education in the management of hypothyroidism. Patients are likely to be overwhelmed by the numerous and conflicting pieces of information that they often encounter. So the next one would be the quantitative study. The aim and purpose of this one was to explore the contribution of medical personnel in the formation of eating habits of patients with autoimmune thyroid diseases, or AITDs, in Poland based on patients' experience. The sample for this one was the participants in the research were 208, and 205 of them met the criteria for the final analysis. The data collected methods. Surveys were used to collect data, and chi-squares square tests of independence were done at p less than 0.05. The major findings. A majority of the respondents took it upon themselves to change their diet, and those who got professional dietary advice were more likely to make changes that counted. Lastly, the systematic review and meta-analysis. The aim and purpose of this study: how the Mediterranean diet is a protective strategy for autoimmune thyroid disorders. The sample. The total number of articles included was not specified. The studies were picked based on prejudged eligibility and ineligibility criteria, focusing on the clinical trials, meta-analysis, and published reviews. The data collected methods. The search was conducted on the following databases: PubMed, Embase, and Web of Science, to ensure that all essential articles were captured. Major findings. The Mediterranean diet was found to have positive effects on oxidative stress, gut microbiota, and inflammation, which are all beneficial for the thyroid.
So for nursing implications, we have for monitoring, nurses should monitor lab tests like the thyroid function test and check for TSH levels, since those are low in hypothyroidism. Nurses should also monitor for signs of hypothyroidism, such as fatigue, weight gain, cold intolerance, constipation, and dry skin. For medication, the physician might order levothyroxine before breakfast every day to reduce the symptoms of hypothyroidism. The nurse needs to make sure to tell the patient why they are taking the medications and why it is important for them. Lastly, we have to educate. The nurse needs to educate the patient and tell them that changing their diet to an anti-inflammatory diet might help them reduce some symptoms. The nurse should also educate the patient that the medication has to be taken at the same time every day and to comply with lab tests needed to track the disease. For support, we have the disease might affect the patient's mood and state of mind, so you might have to refer the patient to a place where they can teach them how to deal with problems emotionally, and also making sure that they have the correct support system at home.
And then for the conclusion, the ability to incorporate an anti-inflammatory diet along with compliance of a medication such as levothyroxine is proven to benefit the life of an individual with Hashimoto's. It is evident through research that these diets consisting of multiple vitamins, whole foods, and lean proteins can help improve the symptoms of Hashimoto's that may limit a person's quality of life. The anti-inflammatory diet has decreased symptoms such as tiredness, unexplainable weight changes, and overall inflammation in the body in many patients. Although many expressed that it can be hard to adapt to the diet change, patients continue to follow it due to its ability to improve overall symptoms. If given detailed descriptions of a personalized diet and nutritional support, a patient diagnosed with Hashimoto's thyroiditis can manage their condition and decrease unwanted symptoms that affect their well-being. Thank you guys for watching. Here's our references.